Each year, more than 20 million women undergo an unsafe abortion. Septic abortion is the most common severe complication to unsafe abortion. Post-abortion care is the procedure to diagnose and manage life-threatening complications to abortion. How to diagnose? For all women of reproductive age with abdominal pain, fever, or vaginal bleeding, the following are essential parts of the initial assessment. Record date of last menstrual period and history of family planning. Perform urine pregnancy test, but remember that women who come late with abortion complications may have a negative test. Warning: septic abortion often causes fever, but not necessarily. A septic woman can have an increased temperature, normal temperature, or low temperature. Measure blood pressure, respiratory rate, level of consciousness, pulse, and temperature. Perform abdominal and vaginal examination and assess for tenderness of the uterus, signs of severe peritonitis, such as rebound tenderness, size of uterus, foul-smelling vaginal discharge, and excessive vaginal bleeding. How to manage? Septic abortion can be fatal within hours. A septic abortion should be considered as an abscess, and as such, it must be treated surgically with evacuation of the remaining products of conception with no delay. At signs of excessive vaginal bleeding or signs of sepsis and suspicion of a complication to abortion, act now. Sepsis can be diagnosed if there is a reasonable suspicion of infection and 2 out of the following 3 signs. Systolic blood pressure below 100 mm mercury, respiratory rate of 22 or above, any altered state of consciousness, for example, drowsiness. 1. Call for help. 2. Assess airways and ensure breathing. 3. Establish intravenous access with 2 large bore cannula, size 16 or 18. 4. Give fluid resuscitation, 2 liters of normal saline or Ringer's lactate, fast. Give antibiotics and evacuate the uterus immediately. 5. Do not delay procedure to await antibiotic coverage. Remember, a septic abortion is an abscess that needs surgical treatment with no delay. 6. Give ibuprofen for pain relief, 400 to 600 milligrams. At generalized peritonitis with defense, the patient should be prepared for surgery at a referral hospital. If in a peripheral health facility, stabilize, start antibiotic treatment, and refer. Evacuation of the uterus. Evacuation of the uterus is a life-saving procedure that should be performed even at peripheral health facilities. Manual vacuum aspiration, MVA, is the preferred method for evacuation of the uterus in an uncomplicated case at a gestational age less than 12 to 14 weeks from last menstrual period. At 12 weeks, the uterus is the size of a large orange and should only be slightly palpable above the pubic bone. Dilatation and curettage can be performed at a higher gestational age, up to 16 weeks, when the size of the uterus is halfway between the umbilicus and the pubic bone. This should only be performed at a referral facility. Manual vacuum aspiration. In the following, the procedure of manual vacuum aspiration is demonstrated. 1. Ask for consent for the procedure. 2. Prepare table with sterile field for cannulas and other instruments. 3. Give analgesia such as morphine and or diazepam. See drug list for details. 4. Prepare MVA syringe by closing the valves. 5. Insert speculum and clean vagina with clean water. 6. Insert tenaculum in anterior lip of cervix. 7. Usually the cervix is open. If closed, you dilate the cervix with cannulas, starting with the lowest numbers. The tips of the cannulas are sterile and must touch nothing other than the cervix, the so-called no-touch technique. Proceed dilating the cervix with cannulas up to the number corresponding the gestational week. The cannula is inserted gently until it reaches the fundus of the uterus where a resistance is felt. Don't use force to avoid penetrating the fundus. 8. Pull back the cannula 1 centimeter. Attach the syringe and apply suction by opening valves. Rotate and move forth and back. You might need to detach the syringe, push out aspirate, and apply vacuum again. Repeat suctioning until you feel a gritty sensation and there is no return of tissue. 9. At septic abortion, continue intravenous antibiotics, ampicillin, gentamicin, and metronidazole for 48 hours after the woman is fever-free. Following, give oral antibiotics. Counseling and testing for HIV and other sexually transmitted diseases should be part of post-abortion care. Before discharge, post-abortion care includes advice about and provision of family planning to prevent future unwanted pregnancies. Ask the woman to come back if there's fever, persistent pain, or excessive bleeding.